Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today's episode is packed. Measles cases are on the rise, dengue season is starting early, the FDA might finally be cracking down on food dyes, and the Novavax COVID vaccine story just took a twist. Plus, what is the Vaccine Integrity Project and why should you care? Whether you're a health policy pro or navigating chronic illness, we've got you covered with the context that matters most here at the Health Advocates. Let's start with infectious disease. Measles cases are surging, with 923 reported nationwide as of the close of business on May 3rd. That's inching close to the highest number in 25 years, and we're not even sure how far in we are. Reporting is inconsistent, and we may actually be underestimating the true scope. Here are some key points to note. Texas hotspots. In Texas, there have been 29 cases reported so far in El Paso in just the past 18 days. Cross-border alert. There have been over 600 cases reported in Chihuahua, Mexico. Public concern. 76% of Democrats have expressed concern, according to recent surveys, while only 28% of Republicans say that they're worried. That's according to a poll conducted recently by the Kaiser Family Foundation. There's a political divide that's clearly complicating a unified public health messaging with regards to the measles outbreak. Meanwhile, dengue fever, often called breakbone fever, is creeping northward. It's usually a tropical disease, but climate change and travel are shifting the map. Some key facts to note. There have been 1,568 cases so far, starting from last fall 2024. Most of this is from travel. Hawaii has reported more travel-related cases than usual for this time of year. The risk remains low in the continental United States, but prevention still matters. As we enter summer season, be sure to apply insect repellents that are particularly DEET-based repellents, which are highly effective. Big takeaway for patients: if you live in or travel to high-risk states or territories, such as Texas, California, Florida, or Puerto Rico, keep a bug spray handy. Prevention is your best defense. Now let's talk about food dyes. You may have heard that red dye number 3 is already on its way out. Now, the Health and Human Services Department is proposing to phase out other petroleum-based dyes, but not through a formal ban. This is more of a handshake agreement with the food industry. Key details. Only 2 dyes have been revoked officially. Those are citrus red number 2 and orange B. There are 6 others that have been discussed being removed, but these would be voluntarily phased out by the food industry. There's no clear timeline on the removal of these dyes, and it's not clear whether this will actually come to fruition. Europe, by the way, uses many of these same dyes under different labels, so there may be global pressure growing on these food providers to switch to more natural ingredients. A few things to note from a health policy lens. Natural dyes are more expensive, they're a little less consistent, and they may trigger allergies. They could increase food prices and waste, so labeling transparency will be key. For patients, this likely won't affect your pantry in the coming days and weeks, but it's worth watching. If you or your child has allergies or sensitivities, keep a close eye on labels. It could also affect the costs of products with dyes. I guess one way to avoid this is to eat natural foods only. That's probably what your doctor would tell you anyway. Veggies, fruits, nuts, keep it natural for your health. Now on to vaccines, specifically the Novavax COVID-19 vaccine. Unlike Pfizer or Moderna, Novavax is a protein-based shot. It's been in use under emergency authorization, but the full FDA approval has been a bumpy ride. Approval had been expected on April 1st, but it was paused after the FDA leadership shakeup under the new administration. It's currently back on track, but the FDA says that a new clinical trial is required. This could also eventually affect Pfizer and Moderna down the line. The key context. Vaccine updates now follow the flu model. They tweak the strain, they test the immune response in a small group. When real-world data shows protection, especially for those 65 and over, approval is generally given. So the policy question is, why are they changing this now? Is this because of emerging science or because of politics? And if new trials are required for Novavax and other vaccines, will this delay fall booster shots? We will find out. The key takeaway for patients is that for those over 65 or the immunocompromised, which is many of our patients, stay in touch with your provider. timely access to updated vaccines could be affected by these policy shifts. Our last topic today is something that happens behind the scenes, with concerns that ACIP, the committee that sets vaccine policy, could become politicized. A new group has formed, the Vaccine Integrity Project. What is it? It's an organization set up by the University of Minnesota. It's privately funded, and it includes 8 experts providing independent vaccine guidance, especially if the official process breaks down. Why does this matter, and what does it mean to you? Well, this group has no formal authority, but in the absence of other information making it into the world, third-party credibility can matter a lot. This could be critical if we see eligibility criteria or access rules suddenly change at the federal level. A key takeaway, if you're a clinician or a policy advisor, keep this on your radar. It could become a trusted alternative source in certain times. Once again, that's the Vaccine Integrity Project. And for continued updates and access to our recent coverage of the World Vaccine Conference, be sure to visit ghlf.org/vaccine-resources. That's ghlf.org/vaccine-resources. Well, from rising outbreaks to regulatory rumblings, the public health landscape is shifting. Whether you're advising patients or living with a chronic illness yourself, staying informed is your first layer of protection. If you found today's episode helpful, share it with a friend or a colleague. And be sure to leave us a review, as it will help more people like you find us. Be sure to check out all of our podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.